Wayne Kwong, Man vs. Prostate. Let's dive into how we can do a voiding urethrocystoscopy like these authors have recommended. And it looks something like this. Three main parts. The first part is just a conventional passive urethrocystoscopy. The second step is retroflexing that endoscope, the cystoscope, to look back on the bladder neck. We call that retrovision here. And then step 3 is a voiding urethrocystoscopy. Once again, seeing things dynamically. We're filling the bladder up to 500 milliliters. We are then pulling the scope so that the tip is just distal to the viru montanum. And then we're asking the patient to void. And remember, in their study, over 80% were able to void with the cystoscope in place. And now we can start looking at the movement of the prostatic lobes to see what parts of that anatomy are actually closing off to create obstruction. Or, like in this example, and we'll take a look here, so they're now pulling the flexible cystoscope back, and now they're going to park the end of the cystoscope just distal to the viru, and we can see that right there. If we only did a passive evaluation, it would look like the lateral lobes, maybe some of this anterior tissue, is coming down and obstructing, or from the sides as well. But when we allow the man to void, what do we see? We see that you cannot always just assume that there's benign prostatic obstruction. Male LUTs attributed to BPH can be multifactorial, and you can see it here now. Look, he's voiding that same individual. The lateral lobes are opening up, and the bladder neck is opening up as well. And there is a straight shot. That channel is wide open, allowing for normal flow. Remember, bladder disease, there's primary and secondary bladder disease, and it's very hard for us to discern the contributions between those two relative etiologies. It could be primary bladder disease from aging and or secondary bladder disease from causes like benign prostatic obstruction. Now you can see the channel of the prostate, it's wide open. If you look carefully in the distance, we can pull this back, and there, you see that? Those trabeculations. This individual has evidence of bladder disease. By using voiding active urethrocystoscopy, we can see that his prostatic channel is open, and it is not due to benign prostatic obstruction as a cause for his male LUTs. All right, I hope that helps. I just wanted to have you guys take a look at that, and then we can go to the next video, hopefully in a couple days. All right, take care. Bye.